Hello and welcome, my friends. I've been working on this for some time and I'd like to share with you another very interesting area which I felt needed mention. Contraindication is an area where there are very few remedies mentioned, but it is an area where you can definitely use it practically and clinically to help support your patients. We have to understand here, Hahnemann on one hand mentioned about totality of symptoms, that you have to give importance to the essence of the case, the entire picture of the case, entire portrait of the disease. But also on the other hand, he mentioned about remedies where if you do not have this symptom, that remedy is contraindicated. So he gave importance to singular symptoms. So you can say contraindication is on one way coexistent with Hahnemann's concept of uncommon peculiar characteristic symptoms, striking singular symptoms. So although his emphasis was on totality, but he also emphasized on the importance of singular symptoms, that if this symptom is not present or if this symptom is present, it is a contraindication for that remedy. So that definitely reflects his sincerity, his ingenuousness to the divine art of healing. So you can say those two ideas are contra to each other, the idea of totality and the idea of a singular symptom. But Hahnemann tried to incorporate all of these aspects in his dedication for the art and science of homeopathy. I will share with you a few contraindications from different sources. Borike's Metromedica mentions about particular contraindications. Chamomilla. Borike says that if you find a constitution where the patient is mild and calm, or you find a constitution where the patient is constipated, it is contraindicated for Chamomilla. Chamomilla can never be given to a mild and calm individual. Chamomilla is always irritable, snappish, whining restlessness, piteous moaning. So you can never give Chamomilla to a mild and calm individual. You can never give Chamomilla to a constipated individual. So Chamomilla generally has loose, hot, offensive stools. So if Chamomilla is, if a patient is constipated or if a patient is mild and calm and you think of Chamomilla, it is a contraindication. So again, if these two symptoms are present, it is against Chamomilla. So Chamomilla can never be mild and calm, Chamomilla can never be constipated. Mention Borike's Metromedica. Similar for Mercurius. Mercurius always has excessive secretion. If he has a boil, if he has an abscess, if Mercurius has an ulcer, it's always discharging, excessive discharge. So if you come across a constitution, if you come across a patient where there is dryness of the skin, and that persistent dryness of the skin contraindicates Mercurius. So you can never give Mercurius to a patient who has persistent dryness of the skin. His skin is constantly oozing, secreting discharge which is offensive in odor. So dryness of the skin contraindicates Mercurius. It's almost constantly moist. Jaborandi many times is also known as pilocarpus. It's used as a hair tonic. But many authors, not only Borike but other authors have also mentioned that when you come across a patient with heart failure, when you come across a patient with uremia, or in very old cases, Jaborandi or pilocarpus is contraindicated. You should not give pilocarpus or Jaborandi in a patient with heart failure, in a patient with uremia, especially postpartum, or in a very geriatric case. Jaborandi, pilocarpus is contraindicated. Pilocarpus is a fantastic medicine for hot flushes with profuse sweating. You'll see in Borike it's mentioned it's homeopathic to abnormal sweat. So profuse sweating in hot flushes, profuse sweating in exophthalmic goiter, profuse sweating in many cases. But do not give it in persons with heart failure, in geriatric cases and in postpartum uremia, which obviously is not so common. But pilocarpus or Jaborandi should not be prescribed in such cases. It could be internally as well as if you are applying locally on the scalp as well, contraindicated. Yohimbinum is an aphrodisiac. It's used for strong and lasting erections, helps in cases of impotence, helps in cases of premature ejaculation. But Borike mentions if the patient has had many abdominal ailments, has had a lot of gastritis issues, lot of GERD related issues, lots of bloating, Yohimbinum should not be given in such cases. It may aggravate the situation. So contraindicated in all acute and chronic inflammations of the abdominal organs. So a chronic gastritis, acute gastritis, but you are thinking of prescribing it for the sexual issue, try to avoid Yohimbinum in such cases. So although it's an aphrodisiac, you'll find Borica the line strong and lasting erections, helps in case of impotency, helps in cases of premature ejaculations. But in a patient with predominantly gastric ailments, try to avoid Yohimbinum. We come to Nux Vomica. When a patient comes and tells you that I do not have any urge for stool, no urge for stool at all, I can spend days without any urge for stool. Remember, although you may have other symptoms of Nux Vomica, but Nux Vomica is contraindicated in such cases. Nux Vomica should never be given in cases where there is no urge for stool. When the patient comes and tells you, I have ineffectual urging, I have to go many times, there is passage of stool, sometimes there is not, flatus passes, I come back. Ineffectual urge, frequent urging for stool, I go, no evacuation, I come back. That is Nux Vomica. So irregular peristaltic action, frequent ineffectual desire. He goes, small quantities pass every time, temporary relief after stool, but again the ineffectual urge comes and it goes on in a cycle. So when you come across cases where there is no urge for stool, cases which require bryonia, alumina, that is not a case of Nux Vomica. When you are prescribing for Nux Vomica, it has to be ineffectual urge for stool. They pass small quantities at a time, temporary relief, again the urge comes back. Or they will tell you, I go, there is no evacuation, I come back. So absence of all desire for defecation is a contraindication. So if there is no urge for stool, it is not Nux Vomica. Come to tuberculinum. Borica mentions this right at the end in the relationship part of tuberculinum, that the remedy must not be given without a most careful cardiac examination. So as the surgeon and the anesthetic must know before administering the anesthesia to the patient. So you as a homeopath must know if there is any heart ailment before administering tuberculinum. So tuberculinum, my friends, this is very important practically, is contraindicated in cases where there is perhaps a major cardiac pathology, where there is a children with septal defects, children with congenital heart disease. Although you may have a good picture of tuberculinum, but tuberculinum is contraindicated in such cases. So if you come across geriatric cases with a major heart ailment, valvular heart disease, tuberculinum is contraindicated. If you come across children with congenital heart disease, tuberculinum is contraindicated. Many times, you'll see patients who have had a heart surgery, got it repaired, that's fine. But who have had an active congenital heart disease, if you find tuberculinum mentals very stubborn, no child, still avoid tuberculinum, try to go for something else, which may be analogous to that case. But remedy should not be given without a careful cardiac examination. You see, as a surgeon before the anesthetic, so must the physician know the heart before administering this drug, especially to children and seniles, young seniles. Children, the two extremes of age group, children and old age, major heart ailment, try to avoid tuberculinum. We come to some of the guidelines of N.M. Chaudhary. N.M. Chaudhary mentions for Digitalis. Digitalis is contraindicated in fatty degeneration of the heart. So any fatty heart disease, Digitalis is contraindicated. Where you should use Digitalis? Digitalis is used specially in cases of heart diseases where there is a heart block, where there is disease of the conducting system of the heart. But fatty degeneration, Digitalis is more often contraindicated. Slow pulse, irregular pulse, so diseases of the conducting system of the heart, or even valvular heart disease, it's well indicated. But fatty heart diseases where there is a lot of atherosclerosis, try to avoid Digitalis in such cases. Eupatorium, bone set. So bone pains is the characteristic of Eupatorium. So if you do not have bone pains, it is not Eupatorium. And N.M. Chaudhary gives so much importance to the symptom. So important is the symptom that its absence may be regarded as a contraindication for Eupatorium. As the common name is bone set, bone pains are a must for prescribing Eupatorium. If it's not there, it's not Eupatorium. Feeling in the bones as if it would break. So in any acute fever, with any cold, the bones of the chest ache, the bones of the body ache. When you're prescribing it for malarial fevers, dengue fevers, lot of bone pains as if the bones are breaking. So that's a very important characteristic for prescribing Eupatorium perfoliatum. Mag Carb. Again, N.M. Chaudhary mentions sourness runs through the length and breadth of the remedy. If sourness is not there, it is not Mag Carb. Where do you find the sourness? The mouth is sour. The vomiting is sour. The stools have a sour smell. The sweat has a sour smell. Even the temper is sour. He gets irritable very easily. So, sour temper. And even although there is so much sourness in the system, so much acidity in the system, he still craves for sour. There is craving for sour in Mag Carb. So, when sourness is not there, the acidic taint is not there, it is definitely not Mag Carb. So, a Mag Carb prescription to make, you must have sourness. You can call this, different authors have given this a different perspective. You can call this as an eliminating symptom as well, that if this is not there, it is not that remedy. But contraindication is a very useful term to remember, especially when you are considering a broad totality. I have 10 symptoms, 12 symptoms to work with, and you're thinking of Mag Carb, but oh wow, sourness is not there. I need to think of something else, because that is one of the major characteristics of the remedy. If that symptom is not there, it is a contraindication for that remedy. Cinchona, I won't say this is a very marked contraindication for Cinchona. Presence of thirst in the stage of chill and heat, N.M. Chaudhary mentions the contraindication for China. So, if you are especially considering febrile cases and the patient is thirsty in chill and heat stage, especially intermittent fever, then perhaps it's not China. China is generally thirstless in the chill and heat stage of an intermittent fever. So, Cinchona is contraindicated in such cases. Psorinum, a very important polycrest, a huge polycrest to be honest, a huge nosode which covers many ailments. But N.M. Chaudhary, again a master prescriber of pre-independence Calcutta, and N.M. Chaudhary mentions that he was a direct student of Kent in fact. N.M. Chaudhary mentions that the first and foremost point in this remedy is the great filthy odor of the whole body and carrion-like odor of the discharge. All discharges are very offensive and follows the patient everywhere. Even if you are a partner, if you are a friend, it can cause nausea for you. And it will not be wise to prescribe this remedy unless this symptom is prominently marked. Its absence is a contraindication for the drug. You have all good symptoms of Psorinum, but you do not find offensiveness, you do not find filthiness, you do not find the bad offensive odor of discharges, then you must have a question mark in your mind. It must not be Psorinum. Psorinum to be prescribed offensiveness is a very important, and N.M. Chaudhary says the first factor for this prescription. So, its absence is a contraindication. Its body odor is very strong. They don't have a bath. Nasal discharge, very offensive. Stool, urine, all very offensive. Sweat is offensive. So, that filthy odor follows him through and through for Psorinum, like sulfur. But for Psorinum, if that filthiness is not present, odor is not present, it's a contraindication for Psorinum. N.M. Chaudhary again mentions this for Thyroidinum, that it is contraindicated in tubercular patients. As with many tubercular patients, patients are emaciated. If patient has an active history of tuberculosis, Thyroidinum is contraindicated in such cases. So, you must not prescribe Thyroidinum if there is a tubercular condition can cause further weight loss. If you consider Thyroidinum, Thyroidinum can have two ends. You can have an obese Thyroidinum who is hypothyroid. You can have an emaciated Thyroidinum who is hyperthyroid. So, if that emaciated Thyroidinum has a history of tuberculosis or is suffering from active tuberculosis, you should not prescribe Thyroidinum, as it can further reduce the weight. It is contraindicated in tubercular patients. We come to Mercurius. Any ailment you take up of Mercurius, toothache, joint pains, tonsils, dysentery, with the Mercurius patient, remember it is always aggravation night. And to add to that aggravation, remember that whenever he is in his bed and he has covered himself, and that warmth of bed which has been produced, that is a definite aggravation for Mercurius. So, if you come across a case where it does not have the combination of aggravation night and aggravation warmth of bed, N.M. Chaudhary says it's so important that its absence is a contraindication for Mercurius. I will take at least aggravation night as an important factor for Mercurius. Sometimes you may not have, in the tropical countries, you may not always have the aggravation warmth of bed. The patient may not need the covering in the hot summer weather, but still you can prescribe Mercurius if there is a night aggravation to go with that. So, there are a lot of remedies which have warmth of bed aggravation. You see sulfur, pulsatilla, ledum, but each of them has individual features to differentiate. But when you have the combination of night aggravation with the warmth of bed aggravation, that goes hand in hand together, and that becomes a contraindication for Mercurius. In tropical countries, if the warmth of bed aggravation is not there, even if the night aggravation is there, that's still a good enough modality for Mercurius. So you need the night aggravation to make a Mercurius prescription, because that's a syphilitic miasm, that's a syphilitic modality. Night aggravation, warmth of bed aggravation, that's a syphilitic modality, and Mercurius is the king of the kingdom of syphilis. So that's about your Mercurius. Heading guiding symptoms gives us a few very interesting contraindications. Heading mentions that in fever where there is eruptions, in fever associated with eruptions, do not give aconite. If you consider eruptive fevers, they are slow to arrive, they are slow to develop, and aconite is indicated in cases where there is a sudden and violent onset of symptoms. So fever or eruptive fever, say measles, chickenpox, they are slow to arrive. Aconite is never indicated in such cases, contraindicated in such cases, unless heading says if you have lot of tossing, tossing and turning, patient is mentally restless, fear of death, with dry skin, if that is there, you can prescribe aconite even in eruptive fevers, but it is generally otherwise not indicated in eruptive fevers because they are slow to develop. But if you have the tossing with the mental restlessness, with the fear of death, with the dry skin, you can go for aconite, but otherwise not, because aconite always comes with sudden and violent onset. Physostigma is generally a eye medicine. You'll find it well indicated for glaucoma, eye troubles. But another aspect of physostigma is the circulatory disorders. Weak pulse is considered a contraindication for physostigma. Physostigma's pulse is dug, 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 hard and rapid pulse. You'll find in Borike there is a line, palpitation of the heart is felt in the throat. So much is the pounding of the heart that you can feel the palpitation, the fluttering of the heart, you can feel it in the throat. The carotids are really throbbing. So that is the degree of pounding in case of physostigma. So weak pulse, not indicated for physostigma. Hard and rapid pulse is indicated for physostigma if you are concentrating specially on circulatory disorders of physostigma. Another very interesting word for arnica, Montana. Hyperinosis is rather a contraindication for arnica. Hyperinosis is a condition where there is excessive fibrin formation, and fibrin helps in coagulability. So if you come across a condition where there is hypercoagulability, coagulation is more, clotting is more, that means arnica is contraindicated, because arnica is used in cases where there is purpura hemorrhagica. Arnica is used in cases where there is ecchymosis, there is easy formation of hematoma. So hyperinosis, excess formation of fibrin is a contraindication for arnica, because arnica is indicated for ecchymosis, arnica is indicated for hematomas, arnica is indicated for hemorrhage and purpura hemorrhagica. So if you come across a condition where there is hypercoagulation, remember that is not arnica. We come to squilla maritima. In case of squilla, what is important is the presence of inflammation is contraindication for squilla. Squilla is well indicated in cases of edema, dropsy, where there is lot of waterlogging, where there is a lot of pedal edema, especially in case of diabetes mellitus. Remember, that's a good clinical tip for squilla maritima. Hahnemann advised squilla for case of diabetes mellitus where there is profuse urination, excess urination. Along with that profuse urination, many times there is water retention in the dependent parts, in the legs. So squilla, remember, for cases of water retention, edema, dropsy, but not so much for inflammatory action. Case of diabetes mellitus, Hahnemann really advised for squilla with profuse watery urine. Sometimes there is stress incontinence, involuntary urination. Along with that, there is water retention. Borland in his book Homeopathy in Practice mentions this: if you have this modality, diascoria is bending backward, that is indicated. If you come across a patient who is bending forward and is getting better from the abdominal colic by bending forward, that is definitely not diascoria. Diascoria is contraindicated when the patient is bending backward. When the patient is bending forward. When the patient is bending backward, that is an indication for diascoria. Better by bending backward. Better by bending forward, you have that in colocynth, you have that in cinchona. But if patient is bending forward, and you have other symptoms of diascoria, it is contraindicated. Diascoria is a wonderful remedy for colics, better by bending backward. Another aspect of diascoria, do remember that pain many times radiate to distant parts. So pain starts here, the gallbladder colic starts here, it goes to the toes. His renal colic starts here, it goes to the toes, it goes to the fingers. So pain radiates from a point to the distant parts of the body, and that can happen in diascoria. But you qualify that in a patient who is better by bending backward, and that is important for diascoria.